Sun protection is really important, and that's really important all year round.
Starting to notice dark spots or patches appearing on your skin? Hyperpigmentation is a common skin concern, but something that isn't widely talked about. So together today, let's find out what hyperpigmentation is, why it can occur, what products are available to help reduce the appearance of it, and finally, where you can go to seek further help. I'm Jo Hoare, and you're watching The Skin Clinic with Boots. Hyperpigmentation, I'm going to have to confess, isn't something I know masses about, which I'm very lucky to have Mina with me today. Mina, what do you do for Boots, and why do you know so much about hyperpigmentation?
So I'm a GP that works with Boots Online Doctor.
Can you tell me what hyperpigmentation is?
Those dark patches is a term that could be used. An increase in melanin production. Melanin is what's present in our skin that contributes to colour. We sometimes are familiar with age spots, so as we get older we can...
Is it what people sometimes call liver spots as well?
They're slightly different actually, but yes, when we get older we can get darker patches on our skin, darker spots on our face, on exposed areas. There's a term called post-inflammatory hyperpigmentation. I'm not sure if you heard about that. Acne, for example, approximately 80% can go on to have post-inflammatory.
So those are the marks that are left after we've
right.
had kind of quite a deep spot.
And then there are other conditions that can be caused by hormonal influences, so such as the oral contraceptive pill or pregnancy. And there's a particular condition called melasma. So melasma is really dark blotches that are on the face bilateral, so that means both sides, which can be really debilitating actually.
The one that can almost look a little bit like an eye mask.
So essentially mainly it's on the cheeks. Yes, it can spread around. We also get something called perioral darkening as well, post-inflammatory as well. So patients who suffer with eczema, for example, inflammation from that can trigger the melanin we've talked about synthesis and then cause the dark patches. So triggers for hyperpigmentation, or which we know is from the increased melanin synthesis, is sunlight. So we've got ultra UV light, A, B, and we also have something called visible light as well, and that in particular can trigger the hyperpigmentation, and that's all year round as well.
So hormones, injury and inflammation. What was the third one? Sun. Will we only see hyperpigmentation on the face, or can it be anywhere on the body?
It can be anywhere essentially, but more commonly on the face, sun exposed areas. But then we talked about acne and eczema as examples. So if you've had skin injury, inflammation from those conditions, you could be left with hyperpigmentation. So dark patches is probably a term we're familiar with. And it can happen in all skin colours as well.
All skin tones can suffer from hyperpigmentation. Will it look different in different skin tones?
Yes, I suppose it would really. So the pigmentation can vary, but I think the key thing is seeing a dark patch.
Is there anyone that's more likely to get it, men versus women? Are we likely to get it later in life?
We associate it with ageing, as we've talked about. We associate it with pregnancy, so we talked about melasma in particular. Tend to see it a bit later on in life. Also menopause and perimenopause are associated with hyperpigmentation conditions.
So just like how pregnancy can exacerbate it, hormonal fluctuations in perimenopause and menopause can also contribute to it.
Sun protection is really important, and that's really important all year round. So using a sunscreen, key for maintenance and to protect from all types of visible and UVA and B lights as well. Vitamin C is very effective. It's an antioxidant, can help brighten the skin. So
Vitamin C used in your skincare regime is
yeah,
helpful.
Absolutely. So I'd say using your sunscreen, your vitamin C. There is also niacinamide as well, which can be bought off the shop floor, really, from your local
So
Boots
we
store.
can look out for products that contain niacinamide and vitamin C in particular, and both of those will help reduce the appearance of hyperpigmentation.
Correct.
So if we do decide that we want to treat our hyperpigmentation and we're going down that private route and using a service like the Boots Hyperpigmentation Service, how does that work? Am I seen by a doctor? What information do I have to give?
So with Boots Online Doctor, we have a hyperpigmentation service. It involves filling an online consultation, answering lots of questions about your skin condition. Also uploading 3 photos, so good quality images of where the hyperpigmentation is. A clinician will assess your consultation and make a decision of whether the product you've chosen is the right product for you. But we do have something called Help Me Choose, where we will then guide you on what we feel is the right treatment for your skin condition. You should be reviewed by a clinician within 24 hours.
And in terms of your GP should still be your first port of call if you have any worries about changes in skin colour.
Yes, absolutely. So if you have any patches, dark spots, moles, and if there is any change in colour, if it starts itching, bleed, and essentially any change, absolutely important to see your GP urgently to ensure it's not a malignancy, not a skin cancer.
So if you've got any kinds of concern, it's to the GP?
Absolutely.
Living with hyperpigmentation and reducing its appearance does require patience, but it is something that can be managed. There's plenty that can be done to both help prevent it and cosmetic products that can work towards minimising the appearance. Your GP may be able to help you with some types of hyperpigmentation, or you can use the Boots Online Doctor Hyperpigmentation service. Plus, you can visit a Boots beauty specialist for advice about all the products and ingredients that can help reduce its appearance. Whatever your question, we're here to help.